All right, thank you for staying with the Monday Report Town Hall session. We're having a very important conversation on the link between COVID-19 and mental health. It's important because the World Health Organization says 25% increase in depression and anxiety worldwide has been recorded since COVID-19 hit the different places. And this is a conversation sponsored by the European Union, Aga Khan Foundation and the Aga Khan University Hospital. Still with me in studio is Dr. Catherine Gitau, consultant psychiatrist and section head of psychiatry at the Aga Khan University Hospital, and Dr. Angela Migoa, a pediatric rheumatologist at Aga Khan University Hospital. Let's bring up some of your feedback. There's a lot of questions, but we'll see if we can squeeze in as many of them as we can, as much as time allows. Let's bring that up on your screen and see. You call yourself Party 254. You say, I plead for help. It's been 4 months since I recovered from COVID-19, and since then my sense of smell got lost, and waking up and lacking my smell stresses me. Now, all right, how do you deal with this, Dr. Gitau, especially the stress part? So because he can't smell, he feels stressed.
Yeah. Okay. Definitely, when an illness has been there for a long time, for example, what this viewer is talking about, it definitely is a source of stress.
Yeah.
I would not talk about the techniques of stress management right now, but what I would advise is in terms of seeking care from probably an ENT, ear, nose, throat specialist.
Yeah.
Who would be able to advise better on how best to go about the smell.
Yeah.
Yeah, let me not comment further beyond that.
So first address the smell issue,
yes,
then see whether the stress disappears, which is another
yes,
issue. Because you're talking about the causal effect.
Yes.
So COVID-19 has caused this stress on people. Some people have lost their jobs.
Yes.
Is their mental health issues reversible if the causal factor is addressed, or the trigger? So for example, lack of finances. If all of a sudden you bounce back, are they now okay? Do they need to stop seeing the psychiatrist, or do they continue?
So with mental illnesses, let me first mention that it's on a spectrum, yeah? For example, if you're talking about depression, it ranges from mild, moderate to severe depression. So again, it will depend on how severe the illness was. If it is severe depression, definitely you need to be on treatment and also go through psychotherapy. Now, that treatment takes time. So the medication, you'll take it until a point when we see that there are no symptoms, yeah? And then at that point, you can stop. Now, within that spectrum, moving from severe depression to no depression, yeah. If you get your job along the way, that's good enough. It is a positive factor, protective factor, and will definitely enhance your mental well-being. But then it does not mean at that point you stop the medication if the symptoms are still there. You can still get a job, but the job will also be stressful, adjusting to a new job and all that. So that in itself should not be a factor that will make you stop taking your treatment. But you walk the journey with the doctor until you get to a point where now the doctor says, yeah, now it is safe for us to reduce the dosage of the medication and get you off treatment. Yeah. And it's not only the job that will be protective, also your lifestyle in terms of, are you also practicing self-care? Yeah. Are you exercising? Are you practicing hobbies? Are you doing things that will also help you manage your stress better in terms of increasing or improving your resilience? So there are many other factors to consider, not just the job itself. Okay. Yeah.
And Dr. Migoa, let me bring you on this because I've seen it a lot with the parents. How do you address it in children, giving them what they want? Is that, do you advise for that? Because I've seen when children act up and the parent is like, unataka nini at the phone, then you give them the phone. Is that advisable? Are you supposed to give them what they want?
No, Mr. Mbija, that's not realistic. That's not how life works.
People give them phones all the time. Parents give the children phone all the time. I've actually seen it myself.
No, there's something you mentioned. You said bounce back, and my colleague, Dr. Gitau, talked about resilience. In helping children deal with mental health problems, you can think of it in 3 perspectives, right? There's at the individual level, whereby now you want to empower this child with the right attributes in the physical domain, and Dr. Gitau touched on it. Here you're talking about sleep, and maybe we need another session on sleep, because I'm personally very disturbed about our children in boarding schools who are sleeping for 3-4 hours. I mean, I want to encourage the adults watching this show today, over the weekend when they're not working, try that experiment for 2 days, sleeping for 4 hours. You'll be sick, you know? So anyway, on the physical domain, things about sleep, eating, and then the cognitive domain, let us watch what they are feeding into their minds, okay? And then on the emotional domain, this is where emotional intelligence comes in, where you're encouraging them to be aware of what they feel, and self-regulation, regulating. So just because you want to have pizza now, it might not be the best thing for you.
Yeah.
All right? So that's on the individual level. Then we come to a very important unit, the family level. And I think here I want to emphasize about the gift of being present. That's why I say, that's why today is a gift. That's why it's called present.
Yeah.
Because only when you're present in the lives of your children, some of the things Dr. Gitau is talking about and some of the things we discussed earlier, you will notice the sleep pattern has changed.
Yeah.
That eating habit is not normal, all right? And the other thing that's very important at the family level is offering love and acceptance. If you look at the psychology that people who run gangs, incorporating our children in, you know, drugs or all this, you know, untoward behaviors, what do? They make the children feel loved and appreciated.
Yeah.
And because the child feels loved and appreciated, they feel indebted to this particular individual. Then they do anything this individual wants. Then at the third level is at the society level. And this is where now we are glad that mental health is now taking a key place in the Ministry of Health, where, you know, it's important to come up with policies, but don't just come up with policies, but integrate them. So the school education sector is not left out. The health sector is not left out. And Dr. Gitau talked about breaking the stigma, raising awareness so that we demystify mental health.
Yeah, it's interesting that you raised that, because there's a question here on 22422. You don't leave your name or where you're texting from, but you say, Trevor, I've been experiencing insomnia. It has become difficult for me to do my daily chores. Please ask the experts at your table right now to give me a way forward.
Is that an adult or a child?
This is a number, 22422. So when there's insomnia, what happens? Should they see?
Yes, they need to seek help.
Okay.
Yeah, insomnia is actually quite common, a common symptom. Sometimes it can be primary insomnia in terms of there is no other underlying mental illness or condition that causes the insomnia, but sometimes it can be a symptom that comes along with now some mental illnesses like depression, anxiety.
Do you advise sleeping pills?
I would advise them to seek help from a professional.
First.
Yes, because then some sleeping pills are addictive. So then by taking sleeping pills, without the help of a professional, you can now develop an addiction to the sleeping medication. So it's best if you work with a professional who will guide you on what medications are better for you,
And Migoa, this applies to children as well, when you're saying that the sleeping pattern may change. So do you reverse them back to what they used to do, and how do you do that? Yeah,
so, you know, in pediatrics, we're a little bit conservative. We are not very ambitious on the medication side.
Yeah.
So some of the things that help is developing a sleep routine. You know, and this sleep routine, depending again on the age of the child, you can vary it. Some of the general principles, that contribute towards what we call healthy sleeping habits is to ensure that you've had a good meal in the evening so that hunger doesn't wake you up at night. Sometimes, for some people, certain scents like lavender can help them relax. It's important to ensure that the curtains that lie in the window are heavy. They don't let light seep in. Because what happens is, like even today in this room, if you switch off the lights, but your laptop is still on, it's still emitting light. So your brain still receives a signal, and your brain never really rests. Yes. So we normally first try those strategies. before venturing off into medications. But the other thing that's also important to note, Mr. Ombeja, is that we actually have sleep experts. You know how my colleague here is a psychiatrist, I'm a rheumatologist. We have people who are actually sleep experts. And you know now sleep is so important because it has been shown that people who don't sleep enough are at high risk of hypertension, high risk of hyperacidity, and even dare I say some cancers have been associated with lack of good quality sleep. So sleep should be another topic on your show on another day.
Clearly, let's bring up some of the feedback. There's a lot of it coming through. I'll read some of them. Also, I see others in 22422. You don't leave your name here. I see there's one saying that there's a question to you from 224. I'll read that in just a bit. Let's see what's on air. Bill Novich says, now I understand why I get these anxiety attacks more often. And they started in 2020. Will they affect my health, and do they have a cure? Dr. Gitau, is there a cure? Anxiety?
Let me not talk about a cure.
Yeah.
What I can say is that there are interventions that can be done in managing anxiety attacks. There is medication, yes, and there are various techniques that an individual can use to help in reducing anxiety. And some basic ones are some relaxation techniques like breathing exercises. And these breathing exercises is where you perform slow, deep breathing. I'm happy to say that YouTube has a lot of demonstrations of the same. So yeah, so relaxation techniques like deep breathing exercises, using yoga, meditation, those are some techniques that can help reduce anxiety without even getting to use medication, as well as exercise is a very key thing. Okay. So exercise is something we can do anywhere, anytime. You know, you can walk, you can gym, you can do anything, but just get active at least 30 minutes a day. Yeah. Do some exercise, and it goes a long way in helping you manage the anxiety. Okay. And when you've tried these other techniques and not getting much response, then there is also psychotherapy, where we some of the techniques is cognitive behavioral therapy that is performed by a psychologist or even a psychiatrist who is trained, and then now medication once all those have not worked.
Okay.
Yeah.
Let's bring up more feedback and questions coming through here. I'll try and get through as many of them as I can. Quite a number of them. Lynette Wasonga says, can the government organize barazas through area chiefs to offer guidance and counseling to the affected people? Are there specific health practitioners dealing with the COVID-19 related issues like depression? Are they there, Dr. Gitau? Question 1 and 2. Would that help, okay. Number 1, organizing barazas through area chiefs to offer guidance and counseling? Or do people prefer dealing with mental health in a more enclosed sort of situation and not an open-air baraza?
Yeah.
Which one works best?
If you're talking about an open-air sort of baraza, I'll be talking more in terms of an education, mental health education forums, as opposed to guidance and counseling. But anyway, it's still guidance all the same. But in terms of individual therapy, where you're on one-on-one with the therapist, that's more productive. And I believe the government can afford, but I don't like to leave it to the government. Yeah. But as an individual, I think pushing your area, you know, governing administrative bodies, to put in place structures for you to get the help, you know, at primary healthcare levels, the health centers, dispensaries. These are places that we can actually have healthcare providers, mental health care providers, providing support for those who need the help, those who have been affected by COVID-19. There was another question on which practitioners help manage depression. Yeah. We are many, ranging from counselors who have studied just general counseling, all the way to psychiatrists. So it really varies on maybe who the first person you come in contact with, and then once they do an assessment, they're able to guide you to the right person who can attend to you.
But how do you deal with this in a workplace setup? I know one of my bosses is watching right now. So I mean, and they have their own issues. What should she do? How do you deal with this in a workplace setup?
Okay.
Should we have counselors stationed somewhere, or what happens?
In a workplace setup, it's good to have like a well-being center. Let's just put it that way. If you can have a counselor, it's a tricky situation. It's a tricky question to answer because some people would not like to be seen by the counselor at the workplace.
Yeah.
They'd rather have someone else see them out somewhere else. So I think outsourcing, as long as there's a structure where you know I can seek help when I need it. So if I come to the HR or whoever else is mandated with the well-being,
yeah,
then they can direct me to maybe a counselor out there, not necessarily in the workplace,
yeah,
but connecting me with mental health care professionals out there.
Yeah.
I think having that in place in our workplace is really important.
Okay.
Yeah.
And Dr. Migoa, for children, what works best? Parental care, to just speak to them because there's that disconnect, or someone you've noticed they're close with over time? Which one works best?
Again, I keep saying it goes back to the developmental stage of the child.
Yeah.
Yeah. So you'll find sometimes, like maybe with the toddlers, one of the things that I know my colleagues who handle children with mental health use, they use a lot of play therapy and art therapy. So that way, the child is able to express themselves, you know, by drawing, or sometimes even just watching them play.
Yeah.
You can be able to tell a lot, you know. So that's one strategy for that group. Then you'll find, for example, like the adolescents, right? Depending on the nature of that adolescent, right, and the extent, like she said, mental health is a spectrum. You know, there are some where you're actually able to have a rational discussion, but there are others that might be a bit more extreme. And for each, then the strategies would be different. You know, if they are open, you can enroll them in support groups. And actually, this is an area I think as a country we need to see how we can support our patients to come up with very robust patient support groups. Because me and my sister here, we can talk about these things until tomorrow. But until you're walking in the shoes of the person with the problem, in the spirit of patient-centered care, you will never really understand. And this is the power of patient support groups.
Yeah.
Because we understand the theory of it, the science of it. It's another ball game when you have to live with a teenager who is parasuicidal or a toddler who you're worried is depressed. Yeah? So I think that we need to see how to support our patients to come up with patient support groups.
Okay.
Yeah, yeah.
All right. Let's see what else you're saying here on Twitter. Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report. Let's bring them up and see how many we can run through here. See quite a number coming through. Mutai Obed says establishment of more and more mental hospitals and investment on psychiatric education will help improve mental health. All right. That's a quick comment there. Let's see what else you're saying. Double O, like James Bond, says, I think in our country, depression and anxiety is what drives someone into substance abuse, and almost 80% of Kenyan youths are facing this great challenge. Unemployment is likely to be one of the main cause of mental health. Okay. Nax Vegas, you say majority of Kenyans are depressed and lots of Kenyans are unhappy. Mental health is the biggest killer of Kenyans at the moment because all diseases begin from the mind, and yet mental health is the least focused on. All right. Albanas Musioka says, with the current economic times, almost 90% of our population is mentally ill. It's either mental stress, substance abuse, unemployment, as well as uncomfortable working environment for those who are working. All right. On 22422, I see here, you don't leave a name or where you're texting from, but you say, hi, Trevor and the doctors. I have a brother. While you're talking to him, he's okay. But if you ask him what you have been telling him after 5 minutes, hawezi kumbuka. Ama hata ukimuuliza story ya jana, hawezi kumbuka pia. What could be the problem? Agenda usimbaka sai. Is that also how mental health manifests? That when you're speaking to someone, they seem attentive, but when you ask a minute later, they have no idea what you're saying, and they don't remember what you're saying to them yesterday either.
Yeah, that sounds to me maybe like somebody who is not able to concentrate, and also there's an aspect of memory as well. So I would also want to know what other symptoms they could be having.
Yeah.
But yeah, that is not, I would say there is definitely a problem there. Okay. Yeah.
There's another one here. We don't leave a name or where you're texting from as well. You say COVID-19 left me devastated mentally, physically, and financially. I'm always reminded that I have been given a second chance to life. My savings were depleted, health facility hardly admitted me, and the NHIF refused to cater for my bill simply because I was not admitted in an accredited inpatient hospital during the epidemic, which limited and there was limited hospital bed. I never received any counseling. What is the best way of dealing with mental health when it comes to addressing it through insurance? Is it NHIF? Or where does the person go to? Someone who's watching right now is feeling either something is off or knows someone who something is off with. Yeah. Where do they start?
First of all, the financial issue is definitely something to think about in terms of the socioeconomic status. For sure, Mathare has, much as it has stigma, the stigma around Mathare Hospital, it has very good specialists as well. So if the finances allow for you to be seen in Mathare, then that is a good place to start as well. And I know NHIF covers most of the bill there. Then in terms of now, someone who is more able, then there are various facilities. We can start with our facility. Yeah, so yeah, there are different facilities that one can seek help. Yeah. And I know that insurances do not refuse to cover for mental illnesses unless it is substance use, which is something else that is being challenged now. Substance use related issues and suicide, attempted suicides, those ones are hard to be covered by insurances. But otherwise, depression and all these other conditions are covered by the insurances. Yeah. Yeah.
So do they make a call? Do they just walk in there?
They just walk into the hospital.
Okay.
Yeah, and start the process of seeking care.
And same applies to a parent who thinks the child has a mental issue?
Yes.
You just walk in with the child?
You walk in, as my colleague has highlighted, at our facility, our first stop would either be the outpatient clinics or the accident and emergency department, or what people know as the casualty. That's the starting point, and from there, then things can be scaled up as per the case at hand.
Okay. I see on 22422, there's someone saying, thank you for the conversation on mental health. You make us feel understood and not alone, which is very important for me. Wekesa says, watching Citizen TV, and it's clear that there's a big misconception and misunderstanding of what mental health problem, and mental health disorder means. The experts could do well to educate the public on the same. Mental health problem, and a mental health disorder.
Yes.
So what is the transgression like? Where does it start and where does it end?
Yeah, definitely. So when you're talking about mental health, I had mentioned one of the definitions as per WHO, where we are saying that this person is having mental well-being, able to cope with the daily stresses of life, is productive in terms of occupationally, socially, and they're able to contribute to the community. Now, mental health problem would mean that if you're talking about something like depression, there are some symptoms, but they don't meet the threshold of depression. So there is a problem, but it's not like a full diagnosis of the condition. Yeah. Then when we're talking about the disorder, then that means that it is meeting the full criteria of different conditions. Because for most mental illnesses, when you're making a diagnosis, it's like a cluster of symptoms that are happening at the same time. So that's probably what we'd say would be the range.
Okay.
Yeah.
Sometimes I get questions that I'm not even sure whether I should pose to you, but now that we're being open here and there's a question, they don't leave a name, but they say, hi Trevor, I've been through a lot and I'm only 18 and now I'm thinking of suicide because I think it's the only solution. Please ask the doctors to help.
Trevor, every single human life is valuable and precious. That's the first statement I'll make. The second one is, I want to commend the viewer, and Dr. Gitau highlighted it earlier, for acknowledging how they feel. So to the viewer, we commend you. Because you can't fix a problem unless you acknowledge that there's a problem. I think the third thing I would recommend to the viewer is that you're not alone. There are people in the mental health space, like my colleague, Dr. Gitau, who are ready to assist. Our humble plea is reach out so that we can offer the support that you need, because life has so much to offer. And each of us has a unique purpose, which I am sure this particular viewer still has a purpose to fulfill in serving humanity.
Dr. Gitau?
Let me start by saying that getting to the point of feeling like life is not worth living can happen based on the circumstances, and the person has stated that they have been through a lot. The thing with the past is, unfortunately, most of the time there's nothing much you can do about it. But there are lessons to pick from there, and there are always lessons to learn from difficulties, much as it is very difficult for a person while they're going through it to actually see it. And suicide sometimes comes about when you feel that, you know, I'm alone. So is this person having people who can support him? So can he identify a support system? Can he reach out to somebody who he feels there can be a connection, even if it is a pastor, you know, somebody who can help him or hold his hand at this point. And then once that person is able to reach out, even if it is to a relative or a friend or to the pastor, then can they also direct him now to seeing a professional? Most of the time when one reaches to a point of suicide, that would mean that they have had an underlying mental illness. Of course, there is the stress that has been there based on all those things that he has gone through, which could have triggered probably a depression, if I would put it that way, because he's not talked about anything else about his mental health, but could be having depression, which has now become severe to the point that he's feeling suicidal. And once we treat the depression, you find that now they become more hopeful, and now they start finding more meaning in life, So suicide in itself can be a way that some people use to cope with the overwhelming situation that they are going through, but it's always good to reach out when you feel that, yes, I feel I'm at my end. And even before getting to that point, just reach out and get someone to help.
Okay. I see here there's quite a number of them, just trying to sift through. Says, thanks, Trevor. It has been Clinton Enyenze Agesa who requested help about insomnia. Now I know what to do. I'm going to address my situation with my teachers and seek medication. There's another one here who says, okay, now same question. What can I do to a son who has always said he will kill himself and he doesn't like school at 16 years? How do parents address this? And this is something that it's a thin line, because there's sometimes a child can be acting up, saying random things because they know it will concern you, but sometimes they're actually serious. So how do you know when to take action?
I think by the time you hear a child verbalize that they want to take their life or they want to inflict harm, what we call parasuicide, my humble plea to all guardians, take it seriously. Yeah? As Dr. Gitau mentioned earlier, they are normally warning signs. And the challenge with most guardians today is that they are so engaged, genuinely working so hard to provide for their children, genuinely. That takes away the gift of being present that I spoke about earlier. So in the event you have a child who verbalizes, what is very important is open the doors of communication. And communication doesn't mean talking only at them. Listen. And I often say, listen to what is being said and also what is not being said. So like in this case, they are saying that I think there are issues in school and all that, right? So you would want to probe, and what are these issues in school, right? Somebody intentionally is blocking that off, you know you need to run to that school and find out what's happening, okay? So open the doors of communication. There's something magical when you offer your shoulder for someone to lean on or to hear. The second thing that's very important, and Dr. Gitau has also touched on it, is to show people, in this case, show this child that you love them and you care for them. Love is a very powerful force in this case. And the third thing I would advise this parent is, again, now reach out for professional help. Those are the three things. Open the doors of communication, show love and empathy, and reach out for professional help.
All right. We're really pressed for time here, so I'll allow you just 1 minute of closing remarks each, and I'll start with you, Dr. Gitau. Anybody who's listening and watching you today, what would you want to say to them? And this time I'd prefer you look at the camera so that whoever is watching you, tell them what you think they should hear.
All right. First, I'll start by saying there's no health without mental health. So take care of your mental health. Remember that self-care is not being selfish. So take time to take care of yourself. I know that sometimes there's pressure to work, to go to school, you know, there are so many responsibilities, but always carve out time for yourself. Time to exercise, time to have a nutritious meal, time to meditate or, you know, have a relaxation technique that you practice. Practice a hobby. Stay connected to friends. Even when those depression symptoms are there and you just want to isolate yourself, reach out to a friend. Try as much as possible to stay connected and engage in activities that you enjoy. So I think, let me leave it at that, but take care of your mental health.
All right.
Yeah.
Dr. Miguel?
I think for me, my parting shot is that for our guardians who are watching this show, please let's not forget that children are also susceptible to mental health disorders and diseases. And that as much as we are doing our best to provide for them, let us seize the gift of today and be present in the lives of our children and support them to develop healthy physical, emotional, mental, and social habits. That we should remember we cannot give what we don't have. And so the onus is also on us as the guardians and adults to cultivate these healthy habits, to pursue truth, and to let our children be comfortable with the truth. And lastly, that we shouldn't be in isolation. When you're in a problem, reach out for help. Nobody ever succeeds on their own. Thank you.
All right. Thank you so much for making time for us this evening. Dr. Catherine Gitau, consultant psychiatrist and section head of psychiatry at the Aga Khan University Hospital, and Dr. Angela Migowa, pediatric rheumatologist and Aga Khan University Hospital. And special thanks to the European Union, Aga Khan Foundation, and the Aga Khan University Hospital for making this conversation possible. This is not a conversation that will end tonight. We'll continue having the conversation. My name is Trevor Ombija. It's always a pleasure having you with us. Remember, you're not alone in anything that you're going through. We'll be right here to support you. Just reach out to a friend, reach out to family, reach out, because you're not alone. Remember, Jeremiah 29:11. For I know the plans I have for you, declares the Lord. Plans to prosper you, not to harm you. Plans to have hope for the future. You're not alone. Good night.